Amoxicillin, typical dose 250 to 500 mg uses, treats ear infections, pneumonia, urinary tract infections, UTS in some skin infections. Side effects: nausea, vomiting, diarrhea, rash, allergic reactions. Penicillin, typical dose 250 to 500 mg uses, treats bacterial infections like strep throat, syphilis, and respiratory infections. Side effects: allergic reactions, rash, anaphylaxis, gastrointestinal upset, diarrhea. Ciprofloxacin, typical dose 250 to 500 uses, effective for urinary tract infections, respiratory infections, and gastrointestinal infections. Side effects: nausea, diarrhea, headache, tendon rupture, in rare cases dizziness. Azithromycin, typical dose 500 mg on the first day, then 250 daily for 4 more days, 5-day course. Uses, treats respiratory infections, ear infections, and skin infections. Side effects: nausea, vomiting, diarrhea, abdominal pain, potential heart arrhythmias. Cephalexin, typical dose 250 to 500 uses, commonly used for skin infections, respiratory infections, and bone infections. Side effects: diarrhea, nausea, and allergic reactions. Doxycycline, typical dose 100 mg uses, used for acne, respiratory infections, Lyme disease, and malaria prevention. Side effects: photosensitivity, sunburn, gastrointestinal upset, headache, dizziness. Clindamycin, typical dose 150 to 300 uses, effective for skin infections, dental infections, and infections caused by anaerobic bacteria. Side effects: diarrhea, abdominal pain, rash, and risk of Clostridium difficile infection. Diseases treated: skin infections, dental abscesses, and respiratory infections caused by anaerobes. Levofloxacin uses, used for respiratory infections, UTS, and skin infections. Side effects: nausea, headache, dizziness, tendon damage, and gastrointestinal upset. Diseases treated: pneumonia, otitis, bronchitis, and sinus infections. Trimethoprim uses, treats otitis, respiratory infections, and some gastrointestinal infections. Side effects: nausea, rash, allergic reactions, liver problems, and blood disorders. Diseases treated: otitis, pneumonia, and some forms of gastroenteritis. Metronidazole uses, treats anaerobic infections, including those in the digestive tract and reproductive system. Side effects: nausea, headache, metallic taste, and possible nerve damage in high doses.